Hi, this is Rod Rourke. Welcome back to Rourke Knows, helping you become a better you. Well, today we're going to talk about crazes, plastic surgery crazes on TikTok. And there's nobody better than Dr. Smita. And she's an amazing plastic surgeon from New Jersey, and I was lucky enough to be part of her training 10 years ago, Smita. I can't believe it.
10 years ago, I know. It's been a while.
Oh my God. And not only is she a real plastic surgeon, she's an incredible physician. She trained at Parkland in general surgery, so she's the real deal. And so when she speaks, and please make sure you follow her both on TikTok and Instagram, she's truly a star and rising star in plastic surgery and beyond. So Smita, welcome today. Thanks so much for joining us.
Hi, Dr. Rourke. Thank you so much for having me. I'm excited to be here today with you.
Yeah, it's great. And I think one of the craziest things I've heard, is all of this rage about skincare in tweens and teens or preteens. So how did that happen? How did that come about, Smita?
It's really insane. I think it just shows and proves how strong TikTok is in influencing what we do. And, younger and younger, kids, teenagers are very active on TikTok, and they do what their favorite influencers do. And so when you have influencers like Northwest and all of these young kids piling on skincare that's not necessarily appropriate for their age, we are then seeing a direct consumer effect where everyone is purchasing these products.
Right, and we're going to get into that in a little bit with Drunken Elephant and these other companies. But tell us a little bit about, is there any science behind skincare in preteens and tweens? That doesn't make any sense to me. It's hard enough to get skincare in adults. So tell us about that.
Exactly. No, of course, there is benefit in the basic, skin health, right? So moisturizing, cleansing, sunscreen, those are all things that really anybody can start doing. And the earlier you adopt those behaviors, the better it is in the long term. But by no means is there any evidence to show that anti-aging products is beneficial for young skin. And, retinols, all those alpha and beta hydroxy acids, they're not necessary. And what they're doing is causing more irritation and inflammation and damaging young skin that's already healthy.
Right, exactly. All those irritants and antioxidants, they're great in people like you and me, but not in somebody who's got incredibly young skin. So the things are the cleansers, and of course sunscreen's probably the best of all, right?
Important.
And,
yeah, absolutely. The earlier you start that, the better.
Right, and maybe a moisturizer, and then of course in the teens it's acne, and of course how do you deal with that? Acne, of course, is something you do need some medications for. So what are the things you recommend for that?
Yeah, I think overall lifestyle, right? So, you want to watch your diet and avoid unhealthy habits like picking at your acne. That will always worsen and spread acne. But ingredients that are products that have benzoyl peroxide, for instance, or salicylic acid, those are good things to start incorporating when you are acne prone. Pimple patches are great too because they absorb the moisture. They're hydrocolloid primarily, and so it also avoids picking. But I often tell people, if these initial steps don't work, you always want to get medical attention. So whether you see your dermatologist, your plastic surgeon, even starting at your primary care, but you want to get some guidance in how to treat that without causing further problems.
Right, and of course that's where you actually do medical grade skincare in acne, which of course starts in the teen years. But you should get medical advice, not from, the TikTok doctors. Most of them aren't even doctors. So, and then what about, so what's driving this? I know like North and Kim Kardashian, I looked and they had several million views on that one where she talked about her skincare. Give me a break. That's crazy.
It's insane. Listen, these are young, impressionable adults, right? They're young adults. They're in their preteens, teens. And so when they see their favorite influencers that have, good skin, whether it's filtered or not, most of the time it's filtered, but they want to look like them. And then they have their friends buying products. So, it becomes almost like this trend popularity thing that you have to be, you need to be using these products to fit in. Sure. And so I think it just starts this cycle where, they want the latest and trendiest product, which, like you mentioned, Drunk Elephant is one of them. They do a good job marketing at our younger population, and it's been working.
So what is it? Why is that special? They have all these 6 essential oils or something. Well, tell us about that. What is it that's different about that? I know they have very neutral tone marketing and plain, and they talk about natural oils. I don't. What is different?
I mean, honestly, I think it's still, in my opinion, coming from a medical standpoint, I still think all of those products still fit in the same category as just, it's getting you the right ingredients, but not the right concentrations. And so, Drunk Elephant, for example, it markets themselves as being natural and clean, but at the same time, it still has ingredients that can cause harm to younger skin. And, younger skin should just not be using products like that. And skin that does need products like that should really be focused on the medical grade.
Right. So at that age, you talked about, cleansers, sunscreen is probably the most important, maybe a moisturizer. And then for acne, of course, you're right. It's the salicylic acids and the benzoyl peroxides, all that stuff is, and really that's in all the common over-the-counter things like Clearasil and others that is fine over the counter and can be used. But if you have really significant acne, you need to see your dermatologist or a care provider that does that. So what about later? When is medical grade skincare really more applicable?
Yeah, I think starting on medical grade skincare is really going to be important once we start aging, right? And so our skin quality starts changing in our late 20s, early 30s. We start losing collagen, elastin. That's when we start to see all the fine lines develop. And that's really when you want to start your retinol, your antioxidants, all of those products that can really help build back some of that collagen, strengthen your skin so that as you age gracefully and you age well. So, nobody in their teens should be on these products. The skin just does not need it.
So what if you're in your early 20s? What do you recommend for a patient comes in early 20s and is wanting some great skincare? They've had sun damage. Certainly, I know in Texas, of course, they get sun damage definitely by the 20s. And so
right.
What do you recommend? And, you're in your 20s and early 30s. I mean, that's when you probably would benefit from some skincare. Right?
That's really the best time to start. And, and like you said, sunscreen, no matter what your age, sunscreen is what, you want to use religiously every single day, whether you never even leave the house, you should still have it on if you're by windows. But I think that's a good time to start considering adding a retinol, a retin-A, some sort of tretinoin, vitamin A derivative that will sort of build that collagen as you're losing it. Vitamin C or antioxidants help repair some of that DNA damage we see from the sun. But once you start those products, then, you can target as you get older with chemical peels or lasers and things along those lines. But you need the foundation to be strong. And that's really where the medical grade comes into play. And those products are all, they're tested. We know that they work. They have concentrations that are effective. They're high concentration. So you always want to be under the guidance of a physician. But that's where you're really going to see the results.
Right. And what Dr. Smita is talking about is really the retinols that turn over your skin every 6 days rather than normally it turns over every 6 weeks. And then the antioxidants, they'll help rejuvenate the basal part of the skin layers, the vitamin C, and it has to be one that's totally permeable through the skin. I mean, those all make sense. And then, of course, all the other things that are helpful, the morning cleansers and the moisturizers, depending on your skin. But that's where you need guidance. And I think that's really important. And that really starts in your 20s and 30s. And then what about later? What about in the 30s and 40s? How does that change when we're trying to talk about legitimate skincare?
Yeah. I think when you're a little bit older, again, that's really where you want to start maybe thinking about bumping up your retinol concentration. As we get older, we also lose more moisture in our skin. So you want to really moisturize and keep that skin barrier healthy. But again, that's also when we start seeing more fine lines. We start seeing more sunspots and sun damage. And so, we want to target that with either BBL or other sort of laser treatments. Botox can help with some of the fine lines and wrinkles. So, as we get older, we can start incorporating some of these additional treatments.
Right. Yeah. Once you get some sun damage, and then you can get sunspots, and you can add things like hydroquinone or something to help blend and get rid of some of the pigmented areas. And right, and BBL, broad-based light, works. All those things, but those are all under the care of a physician, plastic surgeon, dermatologist that understands skincare. And, that's really kind of, the skin is the biggest organ in the human body. So that's when you really should start using things that make sense. And by the way, your skin looks awesome, Smita. And
Thank you. It's all the medical grade skincare I use.
Right.
And I started when I was in Dallas, so in my 20s.
Yeah, when you were really hit by the sun. I mean, there's a lot of great sun in New Jersey too, but right. Dallas is a tough place. It's a tough place for sun. And I think that's really what you want. And I think, so, how would you sum it up for the teen that's, watching this, or the mother that has a teenager and saying, what's going on? Well, how do I guide my teenager that's going crazy on TikTok because all of these influencers are just, buying stuff at Drunk Elephant and at Sephora and all these incredibly, great places. But, I mean, what do you make sense of it? Not only that, it's very expensive.
Very, very expensive. I tell people, listen, I don't think you can fight it, right? I think it's good for younger adults to start learning, incorporating good skin health habits. So that includes cleansing and moisturizing, sunscreen, of course. So, rather than maybe purchasing the Drunk Elephant that has the alpha and beta hydroxy acids, you could purchase a Drunk Elephant that's maybe just the cleansers that are gentle. So, I always say it's kind of hard you get easily lost in all of the ingredients, right? And there's key words that I like to sort of have parents look out for. So anything that says gentle on it, or oil-free, non-comedogenic, fragrance-free, those are all pretty safe. And so, I think maybe we can shift the focus from the more anti-aging products to more moisturizing products within the same, trendy lines like Drunk Elephant.
Right. And then also sunscreens, anything SPF 30 or more. Do you like the gel? Do you like the cream? Do you like what do you like, and what's the best?
Yeah, I don't care. As long as you're putting it on, that's all that I'm happy with. For me personally, I like the, lightweight cream that just absorbs into your skin. I don't like smelling sunscreen that we typically associate with going to the beach on my skin, or that greasy residue. So there are great skin, sunscreens on the market that absorb into your skin, no residue, no smell. You put on your makeup or just go about your day, and it's, but you know that your skin is protected.
Yeah, and the key is applied regularly, especially if you go in the water. You got to, there's no waterproof. There's water
every 2 hours. Yeah,
every 2 hours and stuff. So that's great. Well, great advice from a great plastic surgeon in New Jersey, and phenomenal. And of course, she practices what she preaches. She looks amazing. Her skin looks great, and hopefully for our teen and tween viewer, kind of know before you go, and don't do crazy stuff. So, Smita, thank you so much, and tell us how how they can both follow you, but also your website, and so if you're in New Jersey, Dr. Smita is the one to see.
I'm in New Jersey. I have private practice. I have 2 offices in Montclair and 1 in East Brunswick. But you can follow me at the Dr. Smita on Instagram and TikTok. And hopefully I'll see you on social media soon.
Great. Well, Smita, thanks so much for your time. All right.
Thank you so much.
All right. Bye-bye.